Thank you so much. The talk I'm giving tonight is about age and fertility and how that can, how important it is to think about planning fertility and taking age into account. And the first thing that I wanted to talk about is that a lot of women do have children in their late 30s and early 40s. However, it is quite a lot harder to have a child at these ages. And I wanted to explain a little bit about why and some of the things that you can do to take those issues into account. So one of the, so biology is the thing that underpins the age-related changes in fertility. And what happens before you're born is that all the eggs you ever have are placed in the ovary and they replicate 22 times to give you all the eggs you ever get. And then they're actually stored, and they're stored in a way that they're partway through a cell division. And the chromosomes all line up, and then that egg just stays in that position until it's ready to come out. And what happens in the ovaries, and it doesn't matter if it's before puberty or during your reproductive years or if you're pregnant, and up until menopause, all of those eggs just slowly but surely come out of the ovary and give you that chance of conception. But when you reach puberty, the hormonal changes that you get at puberty gather up the group of eggs that are ready and allows one of them to ovulate. And that's when this pattern starts changing. So when you look at the eggs, you can see that they're being used up all the way through your life. And when you're in your 20s, about 25 of them will start at the beginning of a cycle to grow, and the best one will take over and stop the other ones growing. Whereas by the time you're in your 30s and mid-30s, about 15 to 20 will be in that group. And by the time you get into your early 40s, it'll be 10 to 15. And by your mid-40s, about 6. And by the time you get to 45, it's about 1 or 2. And although you have a cycle and that you'll have a normal cycle of hormones as long as there's at least one egg, the group that one egg is getting chosen from is getting smaller and smaller. And because of that, there's the other aspect of that is that the chance of damaging an egg changes over time. So all cells in your body that get damaged will repair themselves, apart from eggs, which just can't do that. And you can see here that this particular egg, one of the little spindles that held the chromosomes got damaged. And on this picture here, these little spindles show that when this egg pulls the chromosomes apart to take some of them out so that the sperm equals the chromosomes, there's going to be extra chromosomes there, and that egg is going to be damaged, and you're not going to have a healthy baby. And the longer the eggs have been in the ovaries, the higher the proportion of them that will be damaged. So what that means is that two things will change. One of them is your fertility, which is the chance of having a baby over time, but also your fecundability, which is the chance of having a baby from one menstrual cycle. And so the lower the egg numbers and the higher chance of having eggs with damage, it reduces the fertility and fecundability, and that changes with age. So when you look at women's age and fertility, you can see here that the chance of having a baby over time is quite high when you're in your 20s, but as you reach your 40s, it drops down. But the other thing that happens is the chance of having a miscarriage where the chromosomes aren't in the right place goes up, because those eggs have been sitting there longer and that they've had a longer time to potentially be damaged. So fertility declines sharply from about 35 years of age, and women over 35 years are much more likely to have unexplained fertility problems because it's harder and harder to find an undamaged egg in a smaller and smaller pool of eggs. But also the chance of miscarriage increases with age. And one of the things which this cartoon shows is that a lot of people who are celebrities have babies quite late. But often what we don't know is that they've used donor eggs, or they've used a different form of a reproductive technology to try and beat these odds. So when you look at the chance of conception per month with one egg that you ovulate, you can see when you're 22, you have the highest rate, and that's about 25%. So about a quarter of the months you will have the chance of a pregnancy. By the time you get to 36, only 15% of cycles will give you that chance of pregnancy with one egg. By the time you get into your 40s, it goes down to just about 7% of cycles will give you the chance of pregnancy. And you can see by the time you get to 45, it's about 1 or 2% of cycles. So you can imagine you need to have more and more cycles to find that one egg that will give you the chance of pregnancy as you get older. So if you have time, if you're in your 20s and you have something that might impact on your ability to conceive every month, you've got a longer time to continue with natural conception. But if you don't have time, if you're getting into your late 30s and early 40s, you have to think about other options, and that's where fertility treatment becomes more important, as you don't have the time to waste. And the thing that fertility treatment does, in particular IVF, is we can give you hormones that instead of one egg every month, which is what you get with natural conception, we can increase the hormones so that the little group that grows at the beginning of the cycle can all grow. And because we take them out of your body, you might be able to get 15 eggs, which is the equivalent of 15 months worth of trying naturally, one egg at a time. And that's where fertility treatments such as IVF work. Men also impact fertility on the basis of their age, and we do know that there's a decline in sperm volume, in the motility of the sperm, and in the morphology of the sperm as people age. The reason for this is quite different, because men don't have sperm that sits and waits for a long time before they're activated to replicate. And men make sperm by having more and more and more replication. So every 16 days, sperm will replicate, and it doesn't stay frozen in time the way eggs will. What, however, happens is that as you get older, the number of replications get higher and higher. And by the time you're 50, the sperm that we see will have undertaken 840 replications. And that means that they've had 840 chances to get one little DNA molecule in the wrong place. And that's what happens with men. They have an increased risk of a single point mutation in the genes, and that can change the way the sperm, so some rare conditions can increase with male age, and it impacts on miscarriage as well. So if you actually look to see what happens with age, maternal age makes the biggest difference, because that actually changes the chromosomes and increases the risk of things like Down syndrome and other chromosomal problems that cause miscarriage. And for men, there's not a lot of difference until you're starting to get to an older age group. And as you can see, if you've got men who are in their 40s to 60s and their partner's 35 to 44, that's the highest chance of having a miscarriage, and that's because of both maternal and paternal age. The other thing that happens is some of the little mutations that can happen as the sperm divide and divide actually give those particular sperm an advantage in terms of replicating. So they replicate faster than the other sperm. And we find certain conditions can be impacted by male age. And these particular conditions are all impacted by this particular gene that gives those sperm a growth advantage. And so things like dwarfism and other fairly rare conditions are a little bit higher as men age. So what can you do? There are several things that you can think of to try and plan, given that these biological processes are always going to impact age-related fertility. And the first one is to think about your own ovarian reserve. And we've now got some very good ways of working that out. And one of them is that women whose mothers were younger when they went through menopause tend to have slightly lower egg numbers. So you can find out from your family if your mother was younger when she went through menopause and think, well, maybe I need to check or start my family a bit earlier. The other really great thing is that we've now got tests, and we've really only had these tests for the last about 10 years. And there's one particular hormone that's only produced by the cells around the egg. And if you take a blood test and measure that hormone, it gives you an idea of how many eggs are in the pool that the one ovulates from. And that can give you some idea of how many eggs are there. It can give you some idea of how many eggs you might get if you undertook IVF, but also it can give you some idea of whether you need to be doing things faster or you can not be worried about going too quickly because you've got plenty of eggs there. And it gives you a way of planning. Another test is an ultrasound scan just after a period. And what you can actually see with the really good ultrasound scans that we've got now are all the little eggs. And we can actually see those because the ultrasound scans have got so good that you can look at the little group before the one takes over and actually work out how many are there. You do have to take into consideration other factors like timing to try to conceive, other blood tests, and also making sure your cycle's regular. And those are really important factors to take in conjunction with these tests. But these tests can really give you an idea of where you sit in terms of whether your ovarian reserve is the same as other people your age, or it's a bit better or a little bit worse, and that can help you plan. So one of the things to think about is working out how to plan when to start a family. And it depends a little bit how many children you want. And what they have been able to work out in this particular paper is that if you want a 50-50 chance of having one child, you can potentially wait a little bit longer. But if you want to have 3 children and you only want a 50-50 chance of that, you do need to look at thinking about starting when you're about 35. And if you want to be 90% certain that you're going to have that size family, and it's still not 100%, you do need to think about starting to have your children when you're younger. And what happens with IVF is because we get more eggs with IVF because we can take them out of your body and not run the risk of having high order multiple pregnancies, you can start things a little bit later if you haven't met your partner till a later age. And so one of the things to think about is how to plan things and to think about when you might want to have children, when you've still got the chance to consider the family size you want. When people haven't had that option, when they've either not met their partner or the timing wasn't right, or they just were not in a position where they could plan to have a pregnancy at an earlier time, and they reach an age where it becomes very hard to have children, and that's usually 45, in their mid to late 40s, we find that pregnancy rates with IVF or naturally are very low. And some women choose to use younger people's eggs that haven't been damaged and that they get a larger number. And that's where donor eggs have helped. But it's really complicated to use donor eggs. And as you can see from this graph, the pregnancy rates stay the same with donor eggs, whereas with age, your own fresh eggs, the chance of pregnancy goes down. And that's because it's the age of the donor, because it's the age of the egg that's important. The womb doesn't age, and the ability to carry a child from the womb's perspective doesn't change over time. It's your medical health that makes the most difference. So it's your heart and your lung function that make the most difference in terms of carrying a child, but it's the egg that's most important in terms of conception. Now, what's happened is we've actually got a really new freezing technology. It's called vitrification, and it freezes eggs, which are very fragile because of the spindles. It freezes them in a matrix, which I always think is a little bit like amber with insects in it, where that matrix holds the egg and holds those fragile spindles in a way that, and because of that, we've been able to actually freeze egg donors' eggs and use frozen egg donor eggs. And people suddenly realize, well, why use a frozen donor's egg when I could use my own egg? And so women in the early and mid-30s can look at freezing their own eggs there and potentially using them at a later date. Now, this technology is not perfect, and I'm sure it will get better. And so there's only a 7% chance of pregnancy for each egg. But most of the time they thaw. There's about a 90 to 95% thaw rate. And if they fertilize, and at the time of freezing, you don't know about the quality of the sperm you use, but if they fertilize and make a high quality embryo, the chance of pregnancy with that high quality embryo is just the same as if you used a fresh embryo at the age you are when you froze the egg. And for people under 35, that's about a 50% chance of pregnancy. So most people would say that it's worth freezing about 15 to 20 eggs to give you a reasonable chance. And we do know that there's no increase in anomaly rates, but there's no guarantee. And sometimes the eggs don't thaw, or they don't fertilize, or the embryos don't take. There are several other things you can do to improve your chance of conception. And one of them is to look at preconception health. The best benefit of preconception health is when both the women and the men participate. And things like looking at your weight and nutrition, looking at smoking, alcohol use, drug use, stress management and self-care, and looking at other factors in your environment that can affect fertility will really help. Excuse me. It's really hard to know when to seek help, and there's some recommendations, although I think if you're at all wanting to know about your fertility, it's always worth asking your doctor. However, the recommendations are that if you're under 35, if you've been trying for 12 months, it's worth going to your GP. If you're between 35 and 40, it's worth going after about 9 months. But if you're more than 40, you should go earlier to give yourself the best chance of conception. There are other conditions that we know affect fertility that you probably need to see your GP sooner rather than later if you're having fertility problems. These are things like polycystic ovarian syndrome, where often you won't have a regular menstrual cycle and an egg isn't ovulating, although often the egg numbers are quite high. Endometriosis causes a lot of inflammation, and that can affect egg quality as well. And medical conditions like thyroid disease, an appointment yourself. So I hope I've explained everything in enough detail, but I'm more than happy to take any questions.
Hi there. It looks like there is one question in the box, which is, can you get this blood test done at your GP? Which is, I think, when you're referring to the AMH test. And
right,
the one come through as well.
I'm as can sorry. Can you answer that question?
Sorry, video's just back.
The certainly most of the time the AMH test is done by a fertility specialist in one of the IVF units, and I'm just not certain in New Zealand whether the GPs can do it, but I think smaller GPs have the test and overall ideal fertility.
And there's another question around the AMH results. Can you see that?
Yes, okay. So the AMH test, what it best does is give you an idea of how many eggs are in the group that the one ovulates from. And an AMH result of 67 is usually quite a high result. And that means that there's lots of eggs there that are in the group that are going to be trying to ovulate. And it generally means you would have a high ovarian reserve even for a young age. It helps us a lot work out the dose for IVF. So with an AMH that high, we would actually need to look at moderating the dose and not making it too high, because if we got 67 eggs coming out all at once, you would get unwell. So we only really want 10 to 15. So it's very helpful to know that we have to be very careful not to give you too many eggs. For other people, when their AMH is much lower, if it was 5 or 10, we would want to use a high dose and get as many eggs as we could, but we probably would only get, not quite 10, even with high doses. So it helps us a lot plan fertility treatments. It also gives you an idea that if there's a lot of eggs there, you can try more conservative options. So you could look at trying to induce ovulation and get the egg out, and you have time to do that because you're not going to run out of eggs. However, you do have to be mindful about age, because as you get into your 40s, even though you might have quite a high egg number, say 15 to 20, many of those will be damaged. So you don't want to leave it too long either. So you do have to interpret it quite carefully with a lot of different factors. All you need is one great egg. So if you have a low AMH, particularly if you're young and you find that egg that has no chromosomal problem, it can give you that chance of pregnancy. So it's really a matter of trying to find in that group, and we have some idea of the number, and age is the best predictor of damage. All you need is that one egg that's not damaged that will give you that pregnancy. So it doesn't predict pregnancy as well as response to treatment. Another question here is whether a very low AMH, whether you would recommend banking and freezing. And certainly it depends on everyone's personal circumstance. And particularly if you're in a younger age group, which we would think 36 was, we would expect even if you had low egg numbers, some of those eggs would actually be very high quality still. And so that is a situation where you have that opportunity to freeze eggs and to use them when you need them, if you're not in a situation to plan a pregnancy straight away. And if you do have a lower AMH, that is an option that may give you a better chance of pregnancy when you're ready to have children. Okay. So yes, that is a high. Your AMH is high. That is a high level, and almost always the high levels like that we see in association with polycystic ovarian syndrome. And there's quite a debate at the moment that it should actually be used as a diagnostic criteria for polycystic ovarian syndrome, but they haven't incorporated it yet. What it means is that you have lots and lots of eggs in the ovary, but usually they're not coming out the way that, and that's related to hormones and metabolism. And so there's lots of eggs there. They're just not getting the signals to come out. And what that means is you do have you have time, you have good egg numbers provided your age isn't too high, which it isn't. And it's more about, can you get those eggs out? And we do have oral medications like clomiphene or letrozole that will tell the brain to give the ovary more signal to try and get that egg out. And it might take a few months, but you're not going to run out of time and you're not going to run out of eggs. So it means that you've got the options to do things that are less expensive than IVF and can take a little bit more time, and you're not going to run out of eggs. So it's more about getting the hormones right and your metabolism into the right environment that you actually get the eggs out of the ovaries. Okay, so Antoinette said, I'm 34 and I've had a day 3 FSH, which was higher than normal, and I've got a family history of early menopause. Would an AMH test give me more information, or would you recommend that I start trying now, planning children? I think it's very hard to tell people when to have their children, and I think that's really a discussion that you and your husband need to have. And I think that an AMH test might give you more information in terms of when to plan or what technology you might think about using. And I think that's where we've got that opportunity to be able to actually test an AMH. And then if you find the egg numbers are quite low, you've actually got the option to either store them or to think about planning to have your and your family sooner rather than later, or to use other technologies. And I think those choices and the way you decide that is very much a family decision. But I think the AMH helps you get the information you need to make those decisions within the family. Is AMH a predictor of menopause? So AMH gives you some idea that menopause might come sooner or later, but it won't tell you a particular day or a date or a year. What it will tell you is that the average AMH for someone your age is a certain level, and that if your AMH is higher than average, you're probably going to go through menopause later than average. If your AMH is lower than average, you're probably going to go through menopause earlier than average. And how far away from average probably changes the day of menopause equivalently, the year of menopause. But there's no exact date for menopause, and it won't tell you that you will be 50 or 52 or 54. What it will do is tell you that you may go through menopause a bit earlier or a bit later. So it's Janice has asked, I have polycystic ovarian syndrome and an AMH of 150. Does pregnancy improve PCO after a baby is born? So polycystic ovarian syndrome, the egg quality is based on your age, which we would expect to be very good, but you have high numbers of eggs. And the main issue with polycystic ovarian syndrome is to get the eggs out of the ovary. There are two main ways that we can do that, and part of it is you helping us too. One of them, so we think some of the metabolic changes that people with polycystic ovarian syndrome have, and we think that gives people a survival advantage, but it makes it harder for the eggs to come out of the ovary. So if you look after your diet and lifestyle, some of the blocks that stop the signal from the brain to the ovary are removed if you improve your diet and lifestyle. And you don't need to lose a lot of weight, just a few kilos will change the blood profile in a way that it will be easier for the signal from your brain to tell the ovary to let the egg out. The other way is to tell your brain to release more signal, and that's by taking some tablets. The third way is we can actually take over and we can give you injections that are the signal from the brain to the ovaries. Now, those three things, two of them are drugs that we give you, which are the things that make the signals higher. If you can remove the block by reducing your sugars, reducing your insulin in the blood, and changing your metabolism a little bit, and if that continues after a pregnancy, it'll make it easier for you to have more regular cycles, and that will change the symptoms of polycystic ovarian syndrome. Changes do have some medications that can help with that as well. Other things that are going to change the symptoms of PCOS. But we wouldn't, so if you get very fit and healthy, you may well find your cycles become regular, and the changes like acne and hair growth and things will change as well. Sometimes it's very hard to do that, and also, especially after a baby, it's very hard to do that. And sometimes, no matter how hard people try, it's very hard to do that as well. And sometimes, a lot of people would find their cycles are still quite irregular once they've had a baby. So Juanita said, the stats and trends are scary and daunting for a woman approaching 40 and hoping to conceive their own child. Is there still hope though, and what can women in this age group do to improve their chances? So certainly I think there is still hope. We think that women in their 40s, about 50%, it's about 50% of eggs that will have some damage. But there's still 50% that won't. However, the numbers are getting a bit lower. So from natural conception, there's about a 7% chance of conception in every single month. And a lot of women do conceive in their early 40s, particularly up to about 40, 42, 43. A very small number do conceive after 43. And once you get into 45, 46, 47, very, very few women do. And many of the celebrities that are in their 50s having babies, they've used donor eggs usually. So it's something that when you're in your 40s, it's definitely worth being more proactive on how you think about your fertility in terms of planning, and also whether you think about using technologies like IVF. So say your ovarian reserve suggests there are 10 eggs in the pool. IVF will give you 10 eggs in one cycle compared to 10 in 10 cycles if you're trying naturally with 1 egg per cycle. So it can speed things up. And that's why some people would choose to move to things like IVF, because you can have more eggs more quickly and find that one that hasn't been damaged. But even so, at 40, it's still 50-50 whether there's been some damage. But there's also a slightly higher rate of miscarriage, because some of the eggs will fertilize with some damage, and that will lead to a miscarriage.
It looks like all of the questions for now. So thank you very much, Louise Hull, for presenting tonight's webinar. And we hope to see everybody tomorrow evening for Weight and Nutrition with Alice Gormack at 8 p.m. Thank you very much, everybody. And thank you, Dr. Hull.
I hope I provided enough information.
I'm sure you did. Thank you.
Thanks.